Hi, and welcome to our presentation on how to compare Medicare plans. My name is Eddie Krameyer. My wife Sherry and I are the principals of ABC Medicare Help. Our organization is made up of hundreds of agents, and we help thousands of people every year figure out what direction to go with their Medicare plans, and we can help you. Let's take a look at how we can do that. We help people in three primary ways. Number one, we help people get additional Social Security income. Just recently, a husband and wife came to one of our seminars and they're now getting an additional $6,000 a year in Social Security income. If you know someone who's single that's only getting $400 a month in Social Security, usually with one phone call, we can get them an additional $4,000 a year in Social Security income. We also help people save money on healthcare costs, and there's many different ways we do that. We're going to be talking about some of those today. We also help people get more benefits. In fact, many people qualify for benefits that they're unaware of, and we're going to be talking about some of those also today. As independent agents, we represent all types of Medicare plans and most companies that offer them. In fact, we don't charge a fee for our services. Many agents that help people with Medicare represent one company and they try to convince everybody to enroll with that company, whether it's best for them or not, and our agents don't do that. Medicare recommends you review your current coverage and compare it to other coverage options each year to see if there's a better choice. If you're like most people, you don't like change. And that can be detrimental because these plans change every year. And as you just seen, Medicare recommends that you compare your options each year. And as ABC Medicare Help, that's what we do. Our agents can help you compare plans every year to make sure you're staying in the plan that works best for you. Medicare is health insurance for people age 65 and older, or people under age 65 with certain disabilities, and people of any age with end-stage renal kidney disease. There are two ways to get Parts A and Part B of Medicare. One of the most important decisions that you have to make is how are you going to get your Medicare benefits. Number one, you can get your Medicare benefits from the government. That's known as Original Medicare, where you stay on Original Medicare, or you can get your A and B benefits from a private insurance company. That's also known as a Medicare Advantage plan or Part C of Medicare. So option one is to stay on Original Medicare to get your A and B benefits from the government, or option two is to enroll in a Medicare Advantage plan and get your A and B benefits from a private insurance company. Original Medicare is not full coverage. In fact, it is limited coverage and has no maximum annual out-of-pocket. Every health plan I've ever seen has a safety net or a stop loss called a maximum out-of-pocket. That might be $5,000, it might be $10,000, and what that means is if your copays during the year ever hit that limit, then you're done. That plan has to pay the rest of your covered expenses for the remaining of the year. The fact is, Medicare has no annual max out-of-pocket. Original Medicare also does not provide benefits for dental, hearing aids, or long-term care. It also has very limited vision coverage. For someone that stays on Original Medicare, under Medicare Part B, there's an annual deductible, and then there's co-insurance of 20%. So if you're on Original Medicare and you have $100,000 of Part B charges, you owe 20% or $20,000. So what's the number one cause of bankruptcy in America? You got it. It is medical bills. So the bottom line is Original Medicare was never meant to be full coverage. And if you don't have something besides Original Medicare, you're taking a huge financial risk. There are two ways to get more health care coverage than Original Medicare. Option one is to stay on Original Medicare and then enroll in what's called a Medicare supplement, also known as a MEDIGAP plan. Or option two is to enroll in a Medicare Advantage plan, also known as Part C of Medicare. Now let's talk about how Medicare supplement plans or MEDIGAP plans work. They are private insurance plans, so you can only get a Medicare supplement plan from a private insurance company. They pay some of the costs not covered by original Medicare, and these plans only pay if Medicare approves a charge. Are standardized plans identified by plan letters, only work with original Medicare. As of January 1, 2020, no new people eligible for Medicare will be allowed to enroll in MEDIGAP Plan F or MEDIGAP Plan C. If you're one of the millions of people on Medicare Supplement Plan F, you need to be concerned, and here's why. There's a freight train coming down the track that most people are unaware of. If no new healthy people are enrolling in Plan F, what's going to happen? The millions of people that are on Plan F, are they going to get healthier? Or are they going to get sicker over time? Obviously, sicker. And what's going to happen to the claims on those plans? The claims are going to go up, and if the claims go up significantly, what's going to happen to the premium? The premiums are going to go up significantly. If you truly want to stay on a Medicare supplement plan and you're on Plan F or Plan C, I would recommend that you let us help you change plans now if you can qualify through underwriting. Because switching Medigap plans, you can't do it just because you want to. You have to qualify by answering health questions, and we can help you compare Medicare supplement plans. Medicare supplement plans or Medigap plans are identified by letters. Many people confuse these with the parts of Medicare, and these are not the parts of Medicare. These are letters that identify Medicare supplement plans. This is a chart right out of the Medicare and You book. These are the percentages that these plans cover of what Medicare does not cover. We already talked about Plan C and Plan F no longer being eligible for new people getting on Medicare as of January 1 of 2020. I want you to look at the difference between Plan F and Plan G. The only difference is down there where that arrow is, and that's the Part B deductible. For the last several years, the Part B deductible has been a little less than $200, but people on Plan F are usually paying an additional $400 to $800 a year more in premium than Plan G, and the only difference is the one-time deductible each year of right now less than $200. So people can save money by getting off of Plan F and getting on Plan G or on Plan N. On Medicare supplement plans, you can expect rate increases pretty much every year. Most people with Medigap plans will pay between $40,000 and $70,000 in premium over a 20-year period of time, depending on the plan and the company that they choose. Just recently, a husband and wife came to one of our seminars who were both on Medigap plans. He was 87 years old. He was a retired pastor who actually wasn't retired. He was still working because the premium on their plans was almost $10,000 a year. They decided to get off of option 1 and go with option 2, which we're going to cover next. We do recommend Medicare supplement plans often, but not for everyone. It's on a case-by-case basis. Again, there are two ways to get more health care coverage than original Medicare. Option 1 was you stay on original Medicare and then enroll in a Medicare supplement plan, also known as a Medigap plan. Option 2 is to enroll in Part C of Medicare, also known as a Medicare Advantage plan from a private insurance company. To qualify for a Medicare Advantage plan, there are 3 qualifications. Number 1, you have to have both Part A and B of Medicare. Number 2, you have to live in the plan's service area, and that is by county. Some plans will be available in one county but not in another county. And number 3, there's one health question, and that is, do you have end-stage renal disease? So again, you have to have Medicare A and B, you have to live in the plan's service area, and you cannot have end-stage renal kidney disease. You also have to pay your Part B premium no matter which option you go. Are you familiar with the term pre-existing condition? That means not covered. Medicare Advantage plans are not allowed to have pre-existing condition clauses. So it doesn't matter if a person has health issues such as cancer, heart attack, or stroke. They can enroll as long as they qualify and have an election period, and everything that's covered under original Medicare is required to be covered by a Medicare Advantage plan. Medicare Advantage plans are only offered by private insurance companies. You cannot get a Part C plan from the government. They are simply another way for you to get your Part A and Part B benefits. Many people ask me, or they'll say, I understand what Medicare covers, what do these plans cover? And the real question is, what does Medicare cover? Because these plans are required to cover everything that's covered under Part A and Part B of Medicare. All Medicare Advantage plans have an annual max out-of-pocket, and that can differ from one plan to another, and that's one of the reasons you need to shop for plans, because the benefits and the copays and the max out-of-pocket are different from one plan to another. There are also different plan types. There are HMO plans and there are PPO plans. If you enroll in a Medicare Advantage HMO plan, that plan has a network, and you must stay in that network unless it is an emergency. And we have clients that are on HMO plans, but you have to understand, if you're on an HMO plan and you want to go to a provider that's not in the network and it's not an emergency, that plan's not going to pay for it. A PPO plan, on the other hand, has a network, and if you stay in that network, you pay less, but with a PPO plan, you have more freedom. You can go to any provider, any hospital that takes Medicare on a PPO plan. If it's out of network, you simply pay more than the in-network rate. And some people that are on HMO plans don't understand that, and they really ought to be on a PPO plan, and we can help you figure that out. One of the biggest reasons that people enroll in Medicare Advantage plans are because of the extra benefits, such as dental benefits and vision benefits and hearing aid benefits and fitness programs and other extra benefits besides what I've mentioned. And if you're going to be on a Medicare Advantage plan, you need to look at the extra benefits of the other plans that are available in your county. Medicare Advantage plans have fixed copays for specific services, and these copays can vary from one plan to the next, which is another reason why you need to compare Medicare plans, and we can help. If you compare Medicare Advantage plans to group health insurance is usually an HMO or a PPO plan, just like most Medicare Advantage plans are HMO or PPO plans. In fact, most Medicare Advantage plans, if you compare them to group health care coverage, most of these Advantage plans are much better than the group health insurance that you may have been on. One of the biggest questions we get, though, is, now wait a minute, how on earth can these plans be zero premium and be any good? That's one of the biggest questions we get. Let's talk about that. So if you stay on original Medicare, then you would show your red, white, and blue card every time you go to the doctor. So is our government in the insurance business? Yes, they absolutely are. When you go to the doctor, you show your Medicare card, they file a claim with the government, the Medicare then pays that provider. If you decide to enroll in a Medicare Advantage plan, you no longer need to carry your red, white, and blue Medicare card. Don't throw it away. You set it aside, because you're now getting your A and B benefits from a private insurance company. So when you go to the doctor, you simply show your plan card. So remember, whether you go option 1 or option 2, you still have to pay your Part B premium. But with option 2, the government is no longer in the insurance business, and they pay the plan a significant amount of money every month to provide your Medicare benefits. And we all know that private companies can usually do a much better job than the government. That's exactly right. Question: does original Medicare cover prescription drugs? The answer is no. Which part of Medicare covers prescription drugs? That's right, Part D as in drug. Medicare prescription drug coverage can only be obtained through private insurance companies. You cannot get a Part D plan from the government. These plans help cover the costs of prescription drugs. Each plan has its own list of covered drugs or formulary. The cost sharing varies by plan, and you need to know that there is a lifetime penalty that you want to avoid. We find people all the time who are now having to pay a penalty for the rest of their life because they didn't know this one very important rule. Once you qualify for Medicare, if you ever go for 63 days without credible drug coverage or a Part D plan, and then you later want to enroll in a Part D plan, you're going to pay a penalty for the rest of your life. There's several factors to consider in comparing Part D plans. Number one, are my medicines covered? Remember, the formularies are different from one plan to another. The copays are different from one plan to another. The deductibles are different from one plan to another. We have helped many people save thousands of dollars a year on their prescription drug plan costs by, number one, helping them get into the right drug plan. Have you ever gone to the doctor, gotten a prescription, and went to get it filled and were surprised at how much it cost? That happens to almost everyone. If you'll watch our video on how to save money on prescriptions, that'll never happen to you again. Which way should you get your Medicare coverage? Option one, stay on original Medicare, a Medicare supplement plan, and a Part D plan, or a Medicare Advantage plan with drug coverage. Our agents can help you no matter which direction you feel is best, option one or option two. I want you to know there are a lot of insurance agents out there who sell Medicare supplement plans who are not certified to help people with their Part D coverage, and they cannot offer Medicare Advantage plans. Many of these agents have been brainwashed and tell people you should never enroll in a Medicare Advantage plan. I tell people we don't do Medicare supplements, we don't do Advantage plans, we do Medicare. We help people figure out which direction will be best for them, a Medicare supplement plan with original Medicare and a standalone drug plan, or a Medicare Advantage plan. And no matter which direction you've gone, we can help you figure out how to save money in that direction by helping you compare your plans every year. With option one, you basically prepay for treatment. You pay every month whether you go to the doctor or not. And many people will say to me, but I don't pay anything when I go to the doctor. No, you don't, but you pay a significant amount of money every year to the insurance company whether you use the plan or not. With option two, it's more of a pay-as-you-go. So you have little to no premium with option two. And some people will say to me, well, I like option one because I know I have a set amount of money I pay every month. But other people will say, I like option two because I pay little to no premium and I get all these extra benefits that are not available under option one. Well, there's a Medicare rule that's very important that you need to know. It's called the Medicare Advantage trial period. And what it says is, and this is directly out of the Medicare and You book, if you join a Medicare Advantage plan for the first time and you aren't happy with the plan, you'll have special rights under federal law to buy a MEDIGAP policy if you return to original Medicare within 12 months of joining. So the bottom line is, if you're turning 65, if you go on a Medicare Advantage plan for the first time, you actually have a 12-month trial period that during any month, during that first 12 months, if you decide you don't like the Advantage plan, you can go back to original Medicare and enroll in a Medicare supplement plan without answering health questions. Or if you've been on a Medigap plan for years and you've never been on a Medicare Advantage plan, if you want to try a Medicare Advantage plan, you get a 12-month trial period. So at any time during that 12-month trial period, if you don't like the plan, you can go back to original Medicare and go back to your original supplement without answering health questions. That's called the Medicare Advantage trial period. This rule has helped a lot of people decide that they want to go with Medicare Advantage plans. Do you or someone you know have limited income? If so, you may be one of over 1 million people in this country who qualify for extra help and are unaware of it. There's a program called the Prescription Drug Extra Help Program. The Medicare New Book talks extensively about the prescription drug extra help program, which is through Social Security. In fact, Social Security says on their website that this program on average is worth about $5,000 a year per person. My mom was on this program before she passed away. If the doctor prescribed her a medicine that was $1,000, she usually only paid about $3 for that medication. It helps to cover deductibles. It'll help pay drug plan premiums. If people are on this, they can forget about the copays in the drug plan. Their copays are based on their level of extra help. Nearly 1 million people in this country qualify for the extra help program, and they don't know about it. And we don't just tell people about this program, we help people enroll in this program. So if you or someone you know has limited income, we can help you get enrolled in this program. And the income limit for this is much higher than what it is for Medicaid. A lot of people have gone and asked for help, and DHS will say you make too much money, but they still qualify for this program. The Medicare Savings Program pays a person's Part B of Medicare premium. True story. Had a man come up to me after one of our seminars and he said, "Eddie, can you help me cancel my Medicare?" And I said, "Why?" He said, "I make $700 a month and they're taking over $100 out of my check for my Part B premium and I can't live." And I said, "Would it be okay with you if we got the state to pay your Part B premium for you?" And we did. The Medicare Savings Program is also talked about in the Medicare New Book. Many people qualify for it and they're unaware of it. And the income limit for the Medicare Savings Program is also higher than Medicaid. So there's lots of people who qualify who don't know it. Many people qualify for Medicaid and are unaware of it. People who have Medicaid will pay little to no medical expenses. So basically, people who have Medicare and Medicaid will act as a supplement to Medicare, and as long as they go to a provider that accepts Medicare and Medicaid, they'll usually have little to no copays. However, many people live in counties where a Medicare Advantage plan known as a dual eligible plan is available, that they can get their Medicare and Medicaid benefits through a Medicare Advantage plan and get extra benefits like dental benefits, hearing aid benefits, and so forth. Previously, I mentioned people who have limited Social Security income may qualify for additional Social Security income. Our agents can help you figure out if you're one of the many people who qualify for additional Social Security income. And again, we don't charge a fee for our services. This has been an overview of Medicare and some of the points on comparing plans. There are other rules and factors that need to be considered in making choices and comparing plans. Our professional agents can help you do that very thing. In fact, our agents are under the same HIPAA rules as your doctor. So you can have confidence that anything you share with our agents is protected under federal law. Our agents can help you by making Medicare simple. They can help you analyze your current situation and compare plans, help you choose affordable coverage, help you avoid costly mistakes, save you time and money. You don't have to do this alone. We are here to help. Our agents help thousands of people every year navigate this confusing maze of Medicare. The whole reason my wife and I got into this business, when my mom turned 65, she didn't know what to do. And I have made it my life's work to understand this stuff inside and out, to teach other agents how to help people, because my wife and I could only help so many people ourselves. In fact, if you're the kind of person who really has a heart to help people and you need part-time or full-time income, check out our agent website, which is abcmedicare.com. But for now, I want to encourage you to schedule a one-on-one consultation with one of our licensed and certified agents. The form's on our site, or give us a call. We want to help you. We want to make a difference in your life. So God bless and have an awesome day.